Uric acid is a waste product created when the body breaks down substances called purines. Purines are naturally found in some foods and are also produced in the body during cell metabolism. A healthy level of uric acid is important, but too much can lead to a condition called hyperuricemia or high uric acid. This can cause painful crystals to form in the joints, leading to gout attacks. Gout is a form of inflammatory arthritis that occurs when excess uric acid builds up in the bloodstream and crystallizes in the joints. This causes sudden, severe joint pain, tenderness, swelling, and redness, often in the big toe, but other joints can also be affected. High uric acid is mainly caused by either overproduction or underexcretion of uric acid. Risk factors include genetics, obesity, hypertension, diabetes, kidney problems, and diet, especially foods high in purines. Purines are broken down into uric acid, so consuming excess purines from foods can increase levels. Examples of high purine foods include organ meats, red meat, seafood, beers, and sugary beverages. Diet plays a major role in gout prevention and management. While medications may be necessary for some, paying attention to food choices can help keep uric acid levels balanced. This means avoiding purine-rich foods that spike uric acid while emphasizing low-purine foods that help reduce levels. Limiting foods that increase inflammation or cause dehydration is also key. Making simple modifications to your diet by avoiding these triggers foods can minimize gout attacks. In this video, we will cover the top 10 foods to avoid if you are susceptible to high uric acid or suffer from repeated gout attacks. Reducing or removing these foods can help lower your risk and control painful gout symptoms. While dietary changes should always be discussed with your healthcare provider, avoiding these foods is generally recommended to optimize uric acid levels. Let's now go over the top 10 gout-triggering foods one by one. Number 1. Organ meats. Organ meats like liver, kidneys, brains, and sweetbreads have the highest purine content. Just 3 ounces of beef liver contain over 350 milligrams of purines. Organ meats contain about 5 times more purines than muscle meats like ground beef. Consuming them regularly can cause uric acid levels to spike. If you suffer from gout, it's best to avoid organ meats, including liver pills and supplements containing organ extracts. Number 2. Red meat. All meats contain purines, which break down into uric acid. But research shows that red meat, beef, pork, and lamb, is most strongly associated with increased gout risk and recurrent attacks. This may be due to high amounts of purines as well as saturated fat, which enhances inflammation. People who consumed red meat daily had the highest incidence of gout compared to just 1 to 3 times per week. Limit your red meat portions to no more than 4 to 6 ounces twice per week. Choose lean cuts and avoid organ meats. Number 3. Seafood. Certain types of seafood are very high in purines, especially shellfish like shrimp, lobster, scallops, crab, and mussels. Oily fish like tuna, mackerel, and salmon are also higher in purines than whitefish. Enjoying seafood occasionally likely won't trigger gout, but regular high intake can increase uric acid over time. Those with gout should limit total seafood intake to about 6 ounces per week. Avoid shellfish and choose low-purine whitefish like cod, halibut, and flounder for the majority of your seafood consumption. Number 4. Sugary drinks. Beverages sweetened with high fructose corn syrup like regular sodas, fruit punch, and other fruit-flavored drinks are associated with higher uric acid levels and gout risk. Fructose increases purine metabolism, causing more uric acid to form than other sugars. Just 1 to 2 sugary beverages per day significantly raises the likelihood of recurrent gout attacks. Drink plenty of water and avoid regular consumption of soda and juice. Save sugary drinks for an occasional treat and stick to no more than 4 to 8 ounces per day if you need to indulge. Number 5. Beer. Alcohol consumption, especially beer, is strongly linked with hyperuricemia and gout risk. Beer is high in purines and ethanol alcohol, which both interfere with the elimination of uric acid from the body. Just 1 to 2 beers per day increases gout risk twofold compared to none. Light beer has slightly less purines but still carries risks. Avoid regular beer drinking and limit intake to a maximum of 1 to 2 light beers per week. Wine and spirits are lower risk but still should be consumed in moderation. No more than 1 serving daily for women and 1 to 2 for men. Number 6. Sweetened beverages. Sweet tea, juice, sport drinks, specialty coffee drinks, and other sweetened beverages can indirectly affect uric acid levels. Most of these contain large amounts of simple sugars, especially high fructose corn syrup. As mentioned earlier, excess fructose contributes to higher uric acid production. These drinks also tend to displace healthier beverage choices like water. Stick to unsweetened coffee and tea. Limit juice to a small 4 to 6 oz glass diluted with water or seltzer, and stay well hydrated with plain or mint cucumber infused water as your primary beverage choice. Number 7. Refined carbs. Foods made with white refined flour tend to be higher in purines than whole grain foods. Refined carbs like white bread, crackers, pastries, pasta, and rice rapidly spike blood sugar. This increases insulin resistance over time, interfering with proper kidney excretion of uric acid. Limit refined carbs to occasional treats. Choose complex carbs like whole grains, starchy veggies, and legumes as your carb sources instead. Enjoy everything in moderation, though. Large portions of even healthy carbs can increase purine intake. Number 8. High fructose corn syrup. In addition to sweetened beverages, high fructose corn syrup is found in many prepackaged snacks like cereal, granola bars, candies, and baked goods. As mentioned earlier, fructose drives up uric acid more than other sugars. Read ingredient labels and avoid products containing HFCS, especially if it's near the top of the list. Better yet, minimize intake of packaged and processed foods, which tend to be higher in HFCS, sodium, and refined carbs, all contributors to gout risk. Focus on a diet based on whole, unprocessed foods. Number 9. Dried beans. Beans like lentils, split peas, and legumes are generally healthy choices full of fiber and plant protein. However, beans are moderately high in purines. Eating them in excess, especially with other purine-rich foods, can spike uric acid levels. Those with gout should limit intake to no more than 1 cup serving twice per week. Make sure to drink plenty of water to stay well hydrated when eating beans and other plant proteins. Soak and rinse beans well before cooking to help remove some purines. Number 10. Mushrooms. Though lower in purines than many meats and seafood, mushrooms contain moderate amounts of purines. They also have yeast extracts which can increase uric acid. Portobello, shiitake, oyster, and button mushrooms tend to be highest. While not necessarily a main trigger food, regular high mushroom intake along with other purine-rich foods may pose a problem. Limit your mushroom consumption to 2 to 3 times per week, with moderate portion sizes around 1/2 cup. Avoid pairing them with other known high purine foods in the same meal. Being mindful of your diet by limiting or avoiding certain high purine foods is key to controlling gout attacks and symptoms. Keeping uric acid levels in the healthy range requires restricting foods that tend to spike production and inflammation, which includes organ meats, red meat, seafood, beer, refined carbs, high fructose corn syrup, beans, and mushrooms. Focus on anti-inflammatory foods like fruits, vegetables, whole grains, nuts, seeds, plant proteins, and healthy fats instead. Stay well hydrated with water and avoid sugary, high fructose beverages that drive up uric acid. Keep in mind you do not necessarily have to cut these foods out 100% if you don't suffer from gout. Those with mildly elevated uric acid can simply limit intake to a few servings per week rather than daily. Lifestyle factors like achieving a healthy weight, limiting alcohol, not smoking, staying hydrated, and exercising also help control uric acid along with diet. Work with your healthcare provider to determine your specific dietary recommendations based on your health goals and needs. I hope this video gave you a better understanding of which foods to limit or avoid if you are aiming to reduce high uric levels and prevent painful gout attacks. Let me know in the comments if you have any other questions. Thank you for watching this video on the top 10 foods to avoid if you have high uric acid levels. Reducing intake of purine-rich foods as well as other diet triggers is key to maintaining uric acid in a healthy range and preventing gout attacks. Dietary changes should always be discussed with your doctor, especially if you take uric acid-lowering medications like allopurinol. Stay hydrated, maintain a healthy weight, avoid smoking, and limit alcohol. Let me know if you have any other questions on managing gout and high uric acid levels. Please like this video if you found it helpful and consider subscribing for more health and nutrition content. Wishing you all the best in staying healthy. Thanks for watching, and we'll see you in the next video.